Ideally, every woman should see a gynecologist. All throughout her life, there is some role that we play in their lives, and there is a close bond between always your gynecologist and the patient. It becomes like a family. So if your period is started before 9 years, or if your period has not yet started after 16 years, both need investigation. Second is that if you have any issues with your periods or your menstrual irregularities, if your period is lasting less than, the cycle duration is less than 21 days, or if your cycle duration is above 35 days, or you're bleeding excessively, the days have increased drastically or they've decreased drastically, both need attention. Third is if you're trying to conceive, if you're less than 30 years and you're trying to conceive and you haven't been able to conceive unaided for 1 year, and if you're above 30 years and you've been trying for more than 6 months and you're not been able to conceive, you do need investigations and you need help. Fourth is that if you do have any vaginal discharge which is happening repeatedly, and there is itching, there's foul smelling discharge, and that is happening repeatedly, and you also have urinary tract infections which are happening repeatedly during that time. Fifth is that when you're trying during your pregnancy, you've conceived, and the journey during your pregnancy and its complications, to handle all of that and to have a smooth delivery. Post that during when your hormones are waning off and you're seeing changes of menopause, during the premenopausal phase where you're dealing with all the hormonal changes and the body is getting prepared for your menopause, to smoothen the entire process and to also realize that what is normal and what is abnormal. Other than this, if during the entire menstrual journey, or your entire time from your menarche to your menopause, if you do have any menstrual irregularities or incidentally any fibroids, polyps or ovarian cysts are found in your ultrasound, they need to be taken care of medically or surgically. Other than that, you must also see a gynecologist on a regular basis. Every year you must review with a gynecologist to rule out any medical conditions, also some conditions which are related, and to also pre-investigate for certain cancers like the cervical cancer, the ovarian cancer. You must do a pap smear regularly. You must get a breast examination done regularly. As prevention is cure, you must see us before anything happens, so we catch it right in time to help you out. Thank you.